Hello everyone. In today's video, we're going to talk about, is Medicare Advantage a disadvantage? So we're going to talk about the advantages of Medicare Advantage and the disadvantage of Medicare Advantage. There's so much talk around Medicare Advantage right now with all of the changes with prescription drug costs and all of that. Plans exiting out of certain areas, certain states. So right now is the best time for this topic. Is Medicare Advantage a disadvantage? Okay, before we could talk about Medicare Advantage plans, we need to talk about Original Medicare. Why would you even need a Medicare Advantage plan in the first place? So Original Medicare is health insurance for individuals 65 or older, paid Medicare taxes 10 years in the US or 40 quarters. So you earn Medicare, okay? You paid for this benefit. Medicare is not a welfare program. It's a benefit that you paid into. You earn Medicare. So you either got Medicare from turning 65, working 10 years or 40 quarters, and you earn those credits to get Medicare, or you have enough working credits and you became disabled at some point and you receive SSDI. And after 24 months with that qualifying disability, you started with Medicare. So you got on Medicare after 24 months. So you either got Medicare from turning 65 or from a qualifying disability after 24 months of being on disability. So that is Medicare, okay? Medicare has two parts. You have your Medicare Part A, which is your hospital coverage. You have your Medicare Part B, which is your medical coverage. Part B also have a Part B premium as well. Original Medicare covers 80%, leaving you behind 20%. And you do not want to be left with a medical bill of 20% because there's no cap, there's no ceiling to Original Medicare, there's no max out of pocket, okay? So 20% of $1 million of a hospital bill or a medical bill is a lot of coins, a lot of money, okay? So you definitely want to protect yourself from that 20%. So one of the options is to get on a Medicare Advantage plan, also known as Medicare Part C, not to confuse Medicare Advantage plans with Medicare Supplement because it's totally different. But in today's video, we're going to talk about Medicare Advantage, the advantages and the disadvantage. So let's get right into it. So the advantage of a Medicare Advantage plan is that it is cost efficient, okay? So with a Medicare Advantage plan, there are max out of pockets, which is good. It's going to help you. It's going to protect you. So most Medicare Advantage plans are 0 monthly premium plans. How is that even possible? That is possible because Original Medicare pays these insurance companies to take on your medical risks. So they make these plans very attractive so that way you can enroll in these plans. They're going to take on your risks. You're going to do a share of costs. You're going to pay a portion. The health insurance plan is going to pay a portion as well. So if you ever wondered why a Medicare Advantage plan is $0 per month, it's because Original Medicare is paying for these insurance companies to take on your risk. So let's talk about the advantages of a Medicare Advantage plan. A Medicare Advantage plan is a all-in-one package, okay? So it's going to include a lot of your benefits and extra perks as well. So a Medicare Advantage plan is going to include dental, vision, hearing. Some of these plans will have extra perks within their plan, such as transportation, a flex card, such as gym membership and such, all in one package. So a lot of individuals value that. So that is definitely an advantage of a Medicare Advantage plan. Now let's talk about advantage number 2. the next advantage of a Medicare Advantage plan is that it does have a max out of pocket. Like I said, original Medicare does not have a max. There's no ceiling, there's no cap. With a Medicare Advantage, there is a cap, and this is going to protect you, okay? So your max out of pocket may be $5,000, $3,000. So once you reach that max, so if you had the worst bad medical year, once you reach that max, then the insurance company will pay the rest. Now, if you're just using the plan a few times out of the year, a few doctor appointments, a few lab tests, maybe a diagnostic procedure here and there, things like that, just normal usage, you would never reach your max. You just pay your copays, which is really nice. So it's really nice to have a plan that have a cap to it. There's a ceiling, there's a max out of pocket. So after you reach your max, then the insurance company, like I said, will pay the rest. So when you choose a Medicare Advantage plan, it's very important to know, what is my max out of pocket? You don't want to be on a plan that if something was to, God forbid, happen, you have to come out of pocket of hundreds and hundreds of thousands of dollars just because you didn't even know what the max was. A good max out of pocket, depending on the state, depending on the area, can be roughly around $3,000 for an HMO and roughly around $8,000 to $10,000 for a PPO plan. Another advantage is the monthly premiums. A lot of these Medicare Advantage plans are zero monthly premiums or very low cost premiums. Why is that? Remember, like I said before, original Medicare pays these companies every single month to take on your risk. They want you to join their plans. So a lot of times the monthly premiums are $0 per month. Now you do have to pay your Part B premium. Some of these plans even have a Part B give back, meaning they will put money back into your Social Security check, reducing the amount that you pay for Medicare Part B. So that is definitely another advantage, that most of these plans are zero monthly premium, and you can even get a give back plan as well. Now let's go over a quick disclaimer when it comes to give back plans. I really want you to compare a give back plan with that insurance company's regular plan. Most likely the give back plan copays will be much higher, especially for days in the hospital and labs and diagnostic procedures and such. So definitely compare and make sure that you're not getting a give back plan, but paying a lot more if something, God forbid, was to happen that year. You're most likely going to pay a lot more for that give back plan. So just a quick disclaimer. Now, I would say a give back plan would be great for someone that's pretty healthy, that doesn't have to use the plan as much. If you have a lot of chronic needs, then I would definitely go with a regular plan versus a give back plan. Now let's talk about the next advantage of a Medicare Advantage plan, and that is the extra perks and benefits within the Medicare Advantage plan. Like I said, it's an all-in-one. It comes with dental, vision, and hearing, and sometimes there's even extras such as transportation, such as gym membership, such as flex cards and such. And if you have both Medicare and Medicaid, in certain states, they would even offer you more perks, such as the healthy food benefit as well. So there could be a lot of perks and benefits when it comes to a Medicare Advantage plan. The last advantage of a Medicare Advantage plan is that it includes your prescription drug coverage. So it's very important to look at the plan when it comes to the benefits, your copays, and your prescriptions, your medications, and such, to make sure that you pick a plan that best fits your medication costs. So that is definitely a pro, a advantage, that it's all in one, like I said, and your prescription drug coverage is included as well. So that is another thing that is definitely an advantage of a Medicare Advantage plan. Alrighty, so we got all of the advantages out of the way. Now let's talk about the disadvantage of a Medicare Advantage plan. Disadvantage number one is you have to stay within doctor networks. if you have a HMO plan, okay? So with an HMO plan, you have to stay within a network. You need a referral to see your specialist. Now, usually with an HMO, you will get more benefits such as more dental, vision, and hearing, but you have to stay within network for most HMO plans. Now, there is another option. You could go with a PPO plan. With a PPO plan, you can see doctors outside of the network. Now, if that doctor is outside of that network and they're going to accept that PPO, most likely you're going to pay more to see that doctor, okay? Now, with a PPO, you don't have to worry about referrals for the most part, so that's nice. And you can see doctors, like I said, outside of the network, but you have to pay more for those doctors. With a PPO, however, you tend to see less benefits with a PPO plan because you can see doctors outside of the network. But those are your options, HMO or PPO. Now, like I said, you have to stay within network. If you have an HMO plan, you can go out of network if you have a PPO plan. However, if all of your doctors take the plan, right, then it's really not a big deal, but it can be a disadvantage for some individuals that you do have to be within the network when it comes to a Medicare Advantage plan. The next disadvantage of a Medicare Advantage plan is pre-authorization or prior authorization. So what is prior authorization? So this is when you must ask permission for a service or a test before it's granted, okay? This can be a little pain and it could also delay treatment. So with a Medicare Advantage plan, sometimes you have to ask for permission for a procedure or a test, or even for you to be on a certain medication. Prior authorization may be necessary. For an example, you're out in the yard and you hurt your hip or something, and the doctor may say you need to have surgery. Well, the insurance company can say, well, first you need to do therapy first, okay, which is called step therapy, or you're going to have to go through some hoops to get that procedure, that surgery approved. So prior authorization can be a bit of a pain, and like I said, it can delay treatment. Another disadvantage of a Medicare Advantage plan is that the plans do change year after year, okay? So it's very important during open enrollment period, which is from October 15th to December 7th, to look at your plan, review your plan, okay? The insurance company will send you out a letter every single year, and it's very important to read this letter. This is your ANOC letter, your annual notice of changes, and it will outline the changes from year to year. So that can be a disadvantage if there's benefits that is slashed that you really enjoyed. This benefit may not be available in the next year. So the plans do change year after year. Sometimes there are slight changes, minor changes. Sometimes there are major changes, and sometimes the plan would completely discontinue out of your area. So that's why it's very important to read your annual notice of change year after year. The final con is definitely geographic limitations, okay? So basically this means that your plan may be limited to when you travel. Usually if you have an HMO plan, you could use your plan when you travel to another state or even to another region within your state. You could use that plan for emergency situations. However, when it comes to a PPO, a lot of times you can use your PPO out of the area, but your plan may not be available in that other state. So it can be some limitations when it comes to traveling. So if you enjoy traveling, then you may want to look into a HMO or a PPO plan that has some travel coverage. So that way it's very important that when you're out of the area, you can still utilize your plan. But like I said, it really depends on the way the plan is designed, if you can utilize that plan outside of your area or not. That's why it's very important to work with a broker that understands these plans in the market. such as ourselves. We'll be more than happy to assist you if you need assistance. Now let's go on to who would actually benefit from a Medicare Advantage plan. I'm definitely going to say that a Medicare Advantage plan is not right for everyone, okay? Just like a Medicare supplement plan, they're not right for everyone. So who would be the perfect individual for a Medicare Advantage plan? Number one, I would definitely say cost. If you cannot afford a Medicare supplement plan, then I would highly recommend a Medicare Advantage plan. Like I said, with a Medicare Advantage plan, there are max out of pocket to help you with the cost of your health. Okay, so that's very important to know. So if you like an all-in-one plan as well, a Medicare Advantage plan can be a perfect plan for you. Remember, these plans come with dental, vision, hearing, and your medication coverage as well, which could be really nice. A all-in-one plan, okay? Also, if you have good health, or say you have chronic conditions, but all of your specialists take Medicare Advantage plans. If all of your doctors are in network, then a Medicare Advantage plan can be a perfect option for your situation. So that is today's video. I hope I made it super clear on the advantages and the disadvantage of a Medicare Advantage plan. Like I said, it's never a one size fit all. So that's why it's very important to make sure that you do your part in your research when it comes to finding a plan that best fits your needs with a Medicare Advantage. And our office would be more than happy to assist you with that. If you need any assistance, give our office a call. If you have any questions, leave them in the comment section below. If you like this video, give it a big thumbs up and subscribe to the channel if you're not already subscribed to see me again. Thank you so much for watching this video, and I'll see you on the next video. Bye.